The future of the state's largest health system is now in the hands of the Nebraska Board of Regents.
The Regents will talk about buying Clarkson Regional Health Services shares in Nebraska Medicine.
This would give the university system full control over Nebraska Medicine. KETV News Watch 7's Beth Carlson sat down with leaders from the NU system and Nebraska Medicine to talk about the decision.
That's right. University of Nebraska President Jeffrey Gold says that Clarkson Regional came to university leaders in 2024 wanting to sell their share of ownership. This week, the Board of Regents will discuss Dr. Gold's recommended deal with Clarkson, one that Nebraska Medicine's Board of Directors strongly opposes. I asked Dr. Gold what that means for patients.
For the past year and a half, Dr. Jeffrey Gold says the university system has worked with Clarkson Regional Health System to envision what comes next.
I certainly was surprised with the request.
After decades as partners in Nebraska Medicine.
They didn't present it to us as a multiple choice question. They said that they want out and they want to transfer their 50% ownership of Nebraska Medicine to the university.
Under the deal Gold is recommending, NU will pay Clarkson $500 million and buy the land it owns for an additional $300 million. Clarkson would then donate $200 million to the university. Gold says this is the best solution for all parties.
Now, truthfully, from the perspective of the community, which is really the most important perspective, that I view, is that they're not going to see any difference. Because when they talk about getting health care, they go to the med center.
The Nebraska Medicine Board of Directors says they strongly oppose the deal, calling it a state takeover. They would rather see the sale go to a replacement member.
That would preserve the status quo and preserve Nebraska Medicine as a independent fiduciary board making decisions that are in the best interest of Nebraska Medicine.
Chair Lance Fritz says the board was not given a chance to give input. Gold says they don't have that right.
Our reading of our bylaws is that Nebraska Medicine has a seat at the table to both go through any member change and ultimately to approve it. That's our reading of our incorporating letters.
All of Nebraska Medicine as a corporate 501c3 enterprise as defined in the articles and bylaws is a dependent board, meaning a subsidiary of both the Board of Regents and Clarkson, who have all of the authority to do what is currently being planned.
Both parties say the priority is patient care.
Gold says that several other Big Ten universities fully control their state hospitals with success. The Board of Regents will discuss this proposal on Friday. Back to you.